without further ado, let me introduce our next speaker. I am so excited to introduce our next speaker, Stephanie Mucha. And I had to practice her name because I almost said it incorrectly. So Stephanie Mucha. She has worked for over 20 years in the healthcare nonprofit space. Immediately prior to joining the Autism Society, she directed community outreach efforts at a Chicago-based organization that provides primary healthcare services, including equitable vaccine access to individuals in under-resourced communities. Stephanie has also partnered with clinicians and families at the Child Neurology Foundation and the American Academy of Pediatrics in the pursuit of comprehensive and accessible healthcare. While at the AAP, she led all policy, education, and advocacy initiatives specific to children with disabilities, their families, and pediatricians who care for this population. She was also the lead AAP staff contact and subject matter expert on, you guessed it, autism. Stephanie is an independent consultant who has worked with nonprofit organizations to help achieve their programmatic and strategic goals. She earned her Master's of Public Health degree from Northwestern University and is thrilled to be back a part of the autism community again. This is an extremely timely session and presentation given that April is Autism Awareness Month. So please join me in welcoming Miss Stephanie Mucha.
5 little letters, trips everybody up. Hello, everyone. I'm Stephanie, glad to be here. My clicker. Today I'm going to be talking a little bit about autism, about what we've learned and what we continue to learn through our Vaccine Education Initiative, or VEI, and including some impactful strategies. This project did focus initially on the autistic population, but very often, as most of you know, when we create or improve something for those with high or particular needs, it offers positive effects for the typical population as well. For example, I'm about to walk into a building. You just saw me walk up these stairs. I have mobility. I can use my legs. But the stairs are taped off, broken, unsafe to use. But there's a ramp, and I can use it to access the building. The ramp was not for me, but it still gives me access. So think about that. If you're thinking, oh, autistic population, we don't really do much with them, think about it in a broader sense. Access means access for all. The Autism Society of America has been around since 1965. We're the nation's largest and oldest grassroots autism organization. Our mission is to create connections, empowering everyone in the community with the resources they need to live fully. We have 70 affiliates across the country, and we serve more than 500,000 people each year through our services and programming. We are a national network. Our staff is all across the country, remote. We have local roots, and we have a unique understanding of diversity within the community. One shared reality in the autistic community is the lack of accessible healthcare. And arguably, most of these points could extend to other disability populations, aging populations. They sure apply to underserved population. Something that I did when I was in Chicago, when you think about barriers, when the vaccine came out, there was misinformation, people not speaking the language, people who don't have insurance to get a vaccine, no transportation to get to the vaccine site. They don't understand why it's needed or if it's safe. Or what about the fear of having to share your information because you're undocumented and you're afraid? Those are barriers that working with the disability community, I knew backwards and forwards. But something that I didn't think of, which I'm a little embarrassed to admit, but we're all friends here, the unique barriers that the Autism Society faces specific to vaccines is, how do you get a vaccine when you don't want somebody to touch you? All the other barriers are gone. You have a car, you have insurance, you have an employer. It's like, yeah, go ahead, take some time off, go get your vaccine. But you as an autistic person have such extreme anxiety that the thought of walking into a pharmacy, making the small talk and getting the vaccine is so overwhelming that you don't go. And of course, there's a lot of autistic folks who are not speaking. So the autism community is beautifully diverse. They're part of a broader neurodiverse community, which can include ADHD and many other identities. Just want to underscore again, vaccines do not cause autism. So when we say neurodiversity, raise your hand if you are an iPhone user. Okay, and now what about an Android user? Okay, it's all good. We're all friends here. An Apple app doesn't work on an Android device. That's not because the phone is, or the app of the phone is wrong or bad or broken. Different operating systems, right? So the same logic applies to the concept of neurodiversity. It recognizes that people experience and interact in the world around them in different ways. There's no one right way of thinking, learning, behaving. Think about yourself. I need to make a list. If I see a picture of it, then I know what I'm doing. I want to go ahead of time so I can be prepared. We all think differently, and it's okay. Autism Mini 101. It's an umbrella term for a range of neurodevelopmental differences, and it has variable complexity. Specifically, autism can impact information processing, communication, sensory processing, social behavior, and how emotions are regulated. That said, think about how some of those differences could really impede vaccination uptake in the autistic population. I'll share some supports we identified to increase accessibility for these differences and others, and how you can use them in their communities. Okay, let's talk about sensory differences. Sensory overload is a very common phenomenon for many in the autistic community. And the healthcare setting, people have heard white coat syndrome, it is the perfect storm of anxiety, especially if the last time you went, it was not so fun. But we have found with increased training and access to accommodative supports, which I'll share, we can reduce stress at every stage of the vaccination, improving outcomes not only for the person getting vaccinated, the person bringing the person to get vaccinated, and the vaccination team. So for those who are non-speaking, about 30% of autistic individuals are non-speaking through the lifespan. And interestingly, another 20% completely lose access to verbal communication when they are highly stressed, whether they have an intellectual disability or not. They literally are so nervous, afraid, anxious that they can't use your words. They just can't access them. So if you think about if you are a healthcare provider yourself or a healthcare provider approaches someone to give them a vaccine, there's an assumption. I'm going to walk up to them. They're going to communicate typically. We're going to speak English. And in that moment, as an immunizer, you realize this person is non-speaking, or they don't speak a language, or they're terrified to be here. Then what? So luckily, there's alternative forms of communication, but having access to those resources, whether it's you giving the immunization, the person getting it, their parent, their caregiver, that's the barrier. So we think of offering different accommodations as that first step towards acceptance, equity, knowing what you're going to deal with when you see someone who communicates differently than you. We focus on increasing education, confidence, and accessibility, and our VEI project works to advance health equity by breaking down some of those barriers. And again, like I said, break it down for the people who need it most. It's going to break it down for others. So while misinformation about vaccines and autism still exists, our pilot project, so over a year ago, about 2 years ago now, we had some funding to reach out, and this is right when the first COVID vaccine became available for pediatrics. We asked folks in the community to tell us why they were feeling hesitant about getting the vaccine. And when we asked why, we weren't surprised that it was not that they didn't trust it, or the efficacy of the vaccine, or even that residual, is something bad going to happen to my kid if they get the vaccine. Many Americans were worried. It came out too quickly, all those things. But it wasn't that. Some of them, yes, but they were unwilling to subject their children to the last time they got a vaccination, which was restrained, crying, screaming, being held down, It was so traumatic that they had to make the choice of, do I put my kid through that, or do I give them the life-saving vaccination that we have been waiting for to get us out of this pandemic? That's not a decision anybody should have to make. So this slide actually includes some samplings of those comments about past experiences. He doesn't like unfamiliar people to touch him. They hate shots. They haven't got any in years. Extreme anxiety. We've never been given any other option. So they've learned to expect that the kid will be held down against their will, screaming, crying, horrible for everybody. So what the VEI is designed to remove those barriers that have not historically been addressed. So the strategies, the resources, the tools we use in our program are informed by our community and by science. We applied evidence-based practices for instruction and implementation. Some of our most successful resources are our social stories and visual schedules. So they look something like this, a little checklist. They have been given before the appointment and at the appointment to reduce anxiety by foreshadowing the process. So first we'll get to the office, we'll follow someone into the room, sit down, roll up your sleeve, so the predictability is really helpful. The social stories are evidence-based practices for autistic folks, but they are a strategy that can be generalized to other appointments, dental procedures, drawing blood, etc. These resources are available on our website. It's autismsociety.org/VEI. I'll tell you about those more in a second. Our most popular and impactful resource are our healthcare communication boards. There's symbols on one side. Symbols on one side. Simple stuff like, this is too loud, something to drink, I want a Band-Aid, I need to go to the bathroom. These have been helpful. Oh, and on the other side, there's letters. So if somebody is nonverbal and they can spell out a word with their finger. They provide an option, engage the person, give them the dignity to be part of the conversation, asking and answering questions. These boards have been super helpful with non-speakers, but other people with developmental disabilities, adults that have dementia, also helpful. Non-native speakers, the symbols have been super helpful. Also available. So throughout our pilot year and beyond, we identified the supports and tools that had the biggest impact. What did people like? What made a difference? What calmed people down? What reduced the anxiety? And then we designed accessibility kits to distribute throughout the country. So in addition to those,